Allow me to introduce yourself. Niveen El-Kabag is the Egyptian Minister for Solidarity. She has more than 28 years of experience in the field of development policies and social protection. Before this, she has been the director of Takaful wa Karama, Solidarity and Dignity, a national targeted social safety net program funded by the World Bank and implemented by the Ministry of Social Solidarity. So Dr. El-Kabag, kindly share with us your reflections and ideally some commitments on behalf of the Egyptian government. Thank you. The floor is yours.
Thank you very much. Thank you very much for being a part of this valuable and honorable session. It's a great pleasure to me to participate in it and to represent Egypt and its policies and public programs that's been acted so far. And I would like to thank the speakers for the great benefit that we had from valuable presentations, as well as the young people with their enthusiasm and rights-based approach and actually self-esteem about what's for the future. So I really benefited. I always, before I start, I want to pass my recognition and valuing for the young people who are really strong, who persistent, resilient, courageous, audacity for their passing through whatever they pass through. But I always say that there's always a new beginning. So don't get yourself to be down. Don't get yourself to be the sense of being victimized. Everybody passed through challenges. Big support for you. And I'm sure, and I value your strength and resilience. So always have a new start with a new hope. I just want to start with the principles of care leavers. It's very important to put some principles that it's first human rights. It's not charity. It's not something. It's rights-based approach. Second, it's a part of social justice. If we're speaking at this century of social justice and social protection and equity-based approach, so a part of the social justice is to support the care leavers in having their new lives. Third principle is empowerment. And that's why I'm urging them not to feel victimized, not to stress on their weak points or their previous challenges, but to look forward for an empowerment approach. Empowerment, it takes two to tango. They need to be empowered, and we will have our duties in order to provide that support to empower them. Third principle is participatory approach. We don't do it for them, we do it with them. I mean, it's very important to include them with us in having their self-determination and not to do it for them as if they're the receivers and we are the senders. It's a process, and it's a participatory process. I think also it's a collective social responsibility. It's not the state alone. It's not the community. It's a combination of state, community, also support of private sector, volunteers, as well as they themselves are part of it. And I think the NGOs have great part to do. So it's a collaboration, coordination between multiple partners, and it's multidimensional. It's not only health, it's not only education. It takes lots of people and lots of partners with decided on responsibilities and duties for each part and accountability system to strengthen the governance process. It's not my view or my opinion to participate or not. It is a duty that I have to pay as a government entity or as an NGO or even as private sector. I think also it is very important to speak about the coordination and the electronic network between us all. If we're following a case management, we're not starting after the caregivers. It's a long process that should start long way back. I mean, we do not wait till the age of 18 to decide on what they're going to do. It starts early at the start of their childhood, and it needs us all to network, and not to network through meetings, but to network through a database, a unified database that actually gets all people together to know with their ID numbers, all their history, or their cases, or their specific and tailored interventions. So without this electronic networks between us all, with a checklist of different dimensions of interventions, it's going to be very tough for them and very tough for us. And everybody will be running in certain routes out of good intentions, not out of bad intentions, but we're not meeting each other. And eventually, the multidimensional approach will be missing in the care leaving policies. The last thing I speak about, not only the principles, but the core issues that need to be stressed on is the policies, the legal part of it. I mean, since we're speaking about human rights, so we need legal issues, we need policies to be set on, and budgets. I can understand my colleague who had just had his comment, the issue of budget. In general, governments see that physical investment is capital, but social investment is spending. On the contrary, it's investments again, but it's investment in human capital. So the issue is that most of the governments see this as a burden. It's not a burden. It is investment in human capital. It depends on the way how I see it. So the cost-benefit analysis for this is very important to be there. I think the issue of having budgets to be allocated, whether it's budget in the government itself or it's a fund, a national fund, but I mean, we should not wait and then look for the resources. The resources have to be planned and secured in advance. I think also it is a process, as I said, that needs regular planning and regular revising of these planning with a tailored approach for each case according to the specificity of this case. We need a transition period before just the leaving part. I mean, it's not just they wake up in the morning and then they leave. I think having a transition period and preparatory and rehab in order to meet their lives independently is very important. Having their choice and their specification, as I said, it's very important to look into the different groups, like people with disabilities, like gender, especially the women who get their divorce. If they are in Oriental culture or Arab world or something like that, they don't go back. I mean, sometimes the girls specifically have their double discrimination. Also, I would like to the light on the drugs and substance issues and drugs and substance abuse that need special treatment. So these vulnerable groups, gender, disability, drugs and substance abuse, mental issues have to be considered. I think we have to get the society prepared for it, so as not to have these young people socially excluded. So it actually complicates things, and they made them feel that sense of victimization and social exclusion. So I think having this of a media campaign or sensitization campaign to improve the image of these young people. I mean, don't get them prejudged, because they are, in general, there are many of the prejudgments about these young people when they get out to life. In their, even in the job placement, they're not necessarily, and we always categorize them in vocational or agricultural issues. They're free according to their capacities and their skills to join whatever they have. I mean, they are not actually locked into different in specific sector, because we see them as that. Let's have vocational training, let's have something like that. They could be professionals, they could be workers, they could be blue collars or white collars. So if they are free in terms of their capacities and skills, that we are due to prepare them for it. I think the issue of having placement services and living arrangements is very important. Otherwise, we will see other children in the streets, on the streets. Job placement and career advising, many of them, they don't have career advising or social care, healthcare, and that's why we're opting in Egypt. I'll tell you when I finalize, I'm about to get finished, but I mean, healthcare is very important, secured healthcare. And again, it's not charity, it's secured healthcare. I think also the social care and referral services, they're out, but we have to keep a liaison between us and them, and to have the door semi-opened. The door hasn't to be that open or completely closed. So they could refer to us whenever they need, or refer to a piece of advice, piece of whatever they have. I think also the postgraduate education. Sometimes it is important. It could be subsidized. It doesn't have to be completely free because they're grown-ups now. But supporting them on this, especially with private sector, because they're improving and getting up the image of these young people. Prosthetics for people with disabilities is very important because through these prosthetics, they can have jobs. And I mean, if they are recovering from substance abuse, their support and medication should be paid. So it's, again, when I speak about their image, is protecting them from bullying, and putting with them their future plans, especially that they're about to constitute a new family life. So they should be mentally, psychologically, and emotionally correct. I mean, I don't mean correct per se, but I mean in a good position. I think tracing them, as we have automated case management, tracing where they are, we look for them and we ensure that they are in the right place. We should take a proactive approach. And that's what I do agree with the presentation at the beginning of this session, with a proactive approach. I think also having risk management for them is very important. So I end up with what's happening in Egypt. I think in Egypt, we're not in a good position. Now we are constituting a vision and a roadmap on where we go. We have bits and pieces. I'm not saying we are bad, we're that much bad, but we're not constructive enough in a right methodological, constructive way together. And that's what I was just starting with, is that it needs a vision and it needs a clear roadmap. Different partners with different responsibilities, with different accountability if I don't commit that responsibility. So what we're trying to have in Egypt is we constituted a social justice committee run by the Prime Minister, and it is constituted of about 14 ministers. It's not only for care leavers, it's for all vulnerable groups and for poor and vulnerable groups, how to plan for them, how to have our policies harmonized together, and how to allocate budgets that go in accordance with these policies. So we constituted this social justice committee. I think we're developing a strategy and, as I said, a roadmap together with different programs and projects with different responsibilities. The budget is not yet secured totally from the government. We are advocating amongst us as different government partners. So, for example, Ministry of Social Solidarity is promoting and advocating to Ministry of Finance, to Ministry of Planning, to Ministry of Education. So actually, we're doing the sensitization amongst ourselves, not between us and community.
I have to wrap up, yeah? Thank you so much for your inputs. This was extremely helpful and interesting, and I think we have a lot of confidence by your profound understanding of the challenges of the care leaving process in Egypt, which gives us the confidence that this will be your commitment to continue engaging and supporting young people in their process. So thank you so much for the very crucial and important topics you have touched.